try to bring
She
her out
just
here.
glistens. She really looks pretty.
She does. I think we've unwound her so much she's ready to go lay down.
She'll let us know whenever she's had enough unwind. She will just kind of walk away. Sometimes she turns her head back as sort of a little thank you, but she'll want to go and just check ligaments and lock up and just relax. And you can just see her softened ears and face and eyes. She's feeling pretty good right now.
Yeah. So yeah, back to the health scan technique. I utilize the Dynamite products. You can check out more of that information at dynamitemarketing.com/GTOPEL. That's GTOPEL. And along with the Dynamite, I utilize a line of herbal tinctures that are formulated by Dr. Dawn Anderson of Anderson Family Chiropractic. Those tinctures include vitamins, minerals, herbs, and flower essences. I particularly enjoy using the tinctures because they not only support the body on a nutritional level, but also on an emotional level with the flower essences. The emotions are responsible for 65 to 85% of the health of the body. Therefore, working with the emotions is absolutely key in helping the body to heal. So, going along with the concept of emotional balance and healing, that's where the laser and essential oils come in to assist the body as well. You may be able to pick up in the video the violet light that's coming out of this laser. The violet light is the specific wavelength where all the colors come together. A huge factor in supporting the emotions of the body includes the violet light. The violet wavelength is able to support the emotions, calm the animal emotionally, and that's one of the things that's so neat about this particular quantum wave scalar laser is you've got red, infrared, and violet that's all being produced at the same time. So we're not only affecting blood, capillaries, muscles, tendons, ligaments, but we're also positively affecting the emotions of the body through the violet wavelength. And then thirdly, I have mentioned essential oils a couple of times. Essential oils are really awesome for emotional support, but also therapeutic support. So if there's any headaches, if there's any specific trauma to, any part of the body. With horses, we know it's very common that they can go out and roughhouse a little too much, and you can have some bone bruising, some ligament and tendon strain. And I find that actually muscle testing for specific oils and then actually lasering those oils in carries the oxygen, the nutrients, and the alkalinity that comes from the oils, and that laser is able to bring them deeper into the, or I should say, take them deeper into the body and even get down to the cellular level. So that pretty much is a simple introduction of what the health scan technique utilized specifically on horses would involve.
Keep filming.
Okay.
Okay, so go ahead and tell me about your shoulder.
Yeah, one thing I think is really neat about what Dreamer just did here is this mare is used to the laser, so she's going to perhaps be a little bit more sensitive to the wavelengths that are coming out of this laser because her body is already familiar with the frequency and realizing that it does bring her relief. So I went back after working on her cranium. I went back to working here behind the scapula, and I hope that you saw earlier here that she actually brought her weight back more equally on the left front, because it wasn't like that before. It was primarily here on the right front. She brought her weight more equally on this left front that she broke 11 years ago and is standing really quite square. We're actually on a bit of a hill, so she wouldn't stand any differently if she hadn't had the scar tissue than any other horse, because we are definitely on a bit of a grade. So Anyway, I just thought that was a fascinating side note where she actually offered to stand more squarely and balanced as soon as I went back to work on this scapula.
Take a minute and talk about, from a neuromuscular standpoint, what we encountered here. Dreamer, after breaking her cannon bone and having to correct and modify her stance and her walk, that time shortened these muscles and it left a line of tension all the way up to the withers. And so one of the things we noticed was, first we had a lot of swelling and some inflamed tendons, and we used the laser for just a little bit, and she's so sweet, and we used the laser for a little bit, and literally right before our eyes we saw these tendons just shrink right back up to normal. She's such a sweetheart. And we would get in here and do some neuromuscular and myofascial release and get these muscles to let go and release, and they release very nicely, and we think that it's probably improved her gait and just her overall comfort with these tension and tight muscles all the way up here to the spine. So we've used laser, and when we use laser with trigger point, as we find trigger points, we'll locate the trigger point, we'll apply some pressure, and we'll put the laser right through our fingers and right into that trigger point. And we'll work all the way up to the spine, in this case right in here, and we would also laser right up to the same side cerebellum, trying to trace the nerve root right through the spine to the point where we have the injury. So it's always a good idea to work the area that you have involvement and work all the way up to the cerebellum on the same side, because a pain signal on this side will be sending that signal back to the cerebellum where all the nerve roots connect back into the brain on this side.